Living in a rural community means mental health resources are fewer and farther away.
An area nonprofit saw that need and found that sometimes it's easier to start a conversation when you know someone else in the room can relate. Danica Lewis heads to Marshall for this Time for Kids, Time to Talk report.
As a school social worker, Kristin Douma knows kids in Marshall carry around a lot more than just backpacks.
Historically higher rates of depression and anxiety and suicidal ideation than most other schools in Dane County.
Unfortunately, needs change almost as fast as feet and mouths move in the hallways. Just ask Andrea Friesen, who just started her job here at the middle school.
Issues that are affecting the community that also affect students here.
Just 2 years ago, one of those students took their own life.
Probably not a day goes by that we're not having to deal with some type of mental health issue with a student. So it's definitely not something that we can ignore.
There are just over 1,000 students in the entire district. The latest survey results show 1 in 4 kids experience depression. 1 in 3 say they have anxiety, both rates increasing over the last few years. Yet only 8%, about 80 of the hundreds who need help, are actually accessing mental health services outside of school. That means a very high rate of students reaching the point of crisis and needing inpatient psychiatric care.
There's not even a grocery store in Marshall, so there's really not anything here to kind of meet that need.
The challenges don't end there. 400 of the kids enrolled at Marshall are low income.
If you're someone who works an hourly wage job, you can't take off work to take your child to the far west side once a week for an appointment, let alone the gas money to get there.
The options are even more limited for Latino students. In Marshall, almost 20% of the district is Hispanic and 14% speak limited English.
There are very few Spanish-speaking therapists. In the Madison area, there's only a small handful, and so they're usually full. It's very hard to get someone in there because the need is so great.
At one point, they paid a therapist to come into the schools, but that wasn't sustainable on a small district budget.
And Marshall was one of those districts that said, yes, we have a need.
That's Emily Jaime, program manager with Catholic Charities. Her nonprofit solves some of the more rural school districts in Dane County, like Marshall, lack resources when it comes to mental health. But instead of scheduling one-on-one sessions, they started weekly groups led by a professional counselor and all tailored to the kids who need it most.
Students learn so much more from their peers than they do from an adult, no matter how much, they love and trust that adult. There's something about peer-to-peer interaction that can be really healing and can really lower stigma and can be really inspiring and part of kind of their healing.
The overall goal is preventing the worst case scenario, a suicide. But they focus on where that may start, like stress, relationships, and tough transitions. And they found students, particularly middle schoolers, are ready to talk.
The peer-to-peer aspect of it is important, I think, because they see that there's other kids that have some of the same issues that they do.
And while there are more middle and high schoolers admitting they struggle with their mental health, the percentage of students who see a stigma attached to those issues has been cut in half. Marshall looks forward to starting a new group in the new year, knowing the weight on anyone's shoulders, whether it's books or burdens.
I'm not alone. Other people feel the same way.
Is more easily carried by many.
Just sort of gives them a little bit of a built-in support system.
In Marshall, Danica Lewis, WISC News 3.
Catholic Charities started the groups in Marshall and Deerfield at the start of last year and more recently started meeting in Mount Horeb and Stoughton as well.
Each student group lasts 6 to 8 weeks. Catholic Charities also provides training for faculty and staff on mental health topics. If you want to start your own conversation about mental health, there are resources up on our Time to Talk page with the help of our partners at SSM Health. Just go to the Lifestyles tab at channel3000.com and click on Time for Kids to find those stories and articles.